an Italian proverb, if nothing is going well, call your grandmother. And it resonated so deeply with me. And what's interesting for me about this, Purnima, is that I don't have a grandmother. Both of my grandmothers died before I was born. My mother's mother died when she was 18, and my father's mother died when he was in his very early 20s. And that has been a huge loss for me. It's something that I have looked at through my life and felt a real sense of loss that I did not have those two women active in my life. And even though I live far away from my own mother, and we also live far away from my husband's mother, we've worked really hard to give our children access to those relationships. And in fact, my kids have just come back from 3 weeks out with Warren, my husband's mother. And I can already see the strengthening in them as human beings from having that time with her, and the safe place that she provides them. And so I just think that this is a really powerful concept. And it's this idea that, when many of us now in the modern world, we move away from our families are far away geographically and physically, and we don't have that same opportunity to just pop around to the house and have a cup of tea and talk through our problems and get that sense of intergenerational wisdom shared. So this story that we're going to talk about in a little minute it's a really powerful intersection of all of that. So I met a man last year named Dr. Dixon Chibanda, and he's based out of Zimbabwe. And at the time when he was early in his practice as a doctor, he was really drawn to mental wellness for a variety of factors. He had a couple of patients that he deeply cared about who committed suicide, and he felt incredibly hopeless and helpless at that time. And so he deepened his studies of psychiatry, and he became Zimbabwe's only psychiatrist operating in the public sector. Now, this is an environment that has had multiple conflicts. So you're talking about many generations of surviving war and surviving poverty, and the HIV crisis, which has decimated that country as well as many others in sub-Saharan Africa. Tuberculosis, which often is sort of paired quite heavily with HIV epidemics. And so there are a number of factors at play here in creating a mental health crisis. And then you add to that the fact that there aren't the professionals available or trained to tackle this. Recent data I saw said that there were approximately one psychiatrist for every 1.5 million people in Zimbabwe. But even in a city like New York City, where there's one for every 6,000 people, it's still almost impossible to get to everyone who needs help. And so Dixon came up with a really fascinating idea to tap into this concept of generational wisdom. The hospital that he was operating at, not all the nurses were just crazy busy with HIV cases. But the hospital said, well, we've got these 14 grandmothers. He's like, what? We've got these 14 grandmothers, and we can give you some space outdoors. That's what we've got for you. And so, he often has joked, he's like, people think I'm a genius for coming up with this idea. He's like, I didn't really come up with it. It was more that it was just needs must, it was the mother of necessity. Invention is the mother of necessity. And so creatively, he and the grandmothers got together. They came up with this idea of what has been called a friendship bench. And they put benches outside in the hospital grounds, and the grandmothers took shifts to counsel with people. And they set these spaces up that were safe spaces, and individuals in crisis, to whatever degree, could come and sit on a friendship bench. And a grandmother would hear them, would listen to them, and would counsel with them. And he said something really interesting. He said, initially he was trying to use the language of suicidal ideation and proper medical terms around mental illness. And what these women taught him was that he's like, they were saying, you've got to use the language of the people. This particular community is largely from the Shona tribe and the Shona language in the southern part of the African continent. And so they were also able to tap into indigenous wisdom and use language that would make sense from a tribal context around openness, around sharing. And so the grandmothers were able to create a real fusion of the medical training that they were given, which was pretty basic, and then also their indigenous wisdom, and bring these things together. And I think that that's a really powerful model for any sort of medical approach, right? That we need to, as a society, bridge that indigenous wisdom and the scientific knowledge that we've developed over the last few hundred years and bring those together. And that's when we get to a really powerful place.